meeting of gynecologists and obstetricians that's happening in town right now. And joining me this morning is world-renowned sexual health specialist, Dr. Michael Krychman, with the latest on improving the lives of breast cancer survivors. Thank you for being here. We really appreciate it.
Thank you for having me.
So I understand that the survival rate for cancer patients is at an all-time high, including breast cancer. Tell me, if you would, a little bit about what we're seeing when it comes to survival rate of breast cancer.
Well, we're
patients.
seeing that, on average, the 5-year survival is over 90%. What that really means is that women are being diagnosed earlier. We're getting more aggressive in our treatment and diagnosis and what have you. And we're able to really turn breast cancer into a chronic disease, something that a woman will live with for a very long time. So survival rates are at an all-time high, but on the flip side, we do see the impact of radiation, chemotherapy, and even medications that women are taking for many years thereafter.
And at the same time, about 800,000 women are going to discover that they have cancer this year, in addition to the 6.5 million that already do. That number just seems completely staggering to me.
Yeah, it's outstanding, and I think that you can't find a woman whose life has not been touched, either personally or a friend or a colleague or someone who they work with closely, that hasn't been touched by breast cancer. 1 in 8 women will develop breast cancer at one point or another, and it really affects both the woman and her partner, her husband, boyfriend, what have you. So it really has far-reaching implications to society in general.
And some 90% of breast cancer survivors, I understand, report sexual health problems. Can you kind of talk about why that is, and what are some of the options out there for women when it comes to that? Carefully, because we're on a morning show.
No problem. No, I really think it's really important. After the acute crisis of chemotherapy and surgery and radiation, we see that there's direct impact. Women will undergo menopause. The tissues become much more sensitive in terms of in the pelvic region. So there may be some problems in terms of that, and I think it's really a conspiracy of silence. 90% of women have complaints, whether it's painful intercourse or dryness or changes in libido. And there are really safe, effective, non-hormonal products, things like Replens or vitamin E, moisturizers that last for 3 days, can really make a huge difference. And even using an over-the-counter lubricant during the intimate times can really change a woman's life. And we know that it's not just this esoteric, let's feel good and be close and intimate. We really know that sexual health and wellness is very much related to overall general health and wellness. So it helps survival as well.
Can you talk about some of the other quality of life issues that cancer survivors have to deal with?
Well, in my center, we deal with survivorship issues. We deal with menopause, hot flashes, dryness. We also deal with memory changes as well. And, of course, we're also concerned about recurrence, development of other cancers. Memory changes is a big deal as well. And again, this all works in together with the changes of hormones. So, I think the take-home message is that there's a lot of safe, effective things that women can do. They don't have to suffer in silence. And it's, we need to empower women to start the dialogue to help both them and their partners.
One of the most difficult things, I think, to deal with is the partner of the person who's dealing with cancer. They want to be there to support, but they might not know exactly how. Can you give some tips or just things for people to know and take away if they do have a partner that's suffering from cancer?
Well, I think the most important thing and the most important message is surrounding communication. And I would say tell. Your partner can't help you if he doesn't know that there's a problem. So break down this conspiracy of silence and talk about these issues. We know that partners want to be supportive, and there's a lot of things that they can do. So very often the dynamic changes. There's a lot of good resources online. There are providers like myself who specialize in cancer and quality of life issues. So I think the concept of being alive is not good enough. It's how we live and the quality of life, which is really essential to the woman as well as her partner.
Doctor, thank you so much for being here. We really appreciate it. Really important stuff. And if you'd like to get more information from Dr. Michael Krychman, you can do that by picking up his book. It's called 100 Questions and Answers for Women Living with Cancer. Thanks so much. Best to you. All right, Raul, we'll send it on back over to you.
Great information.